first thing you want to do is get all your supplies ready for your procedure. I like to use the T-connector. You don't have to use this, but this allows the patient to be able to go to the bathroom or whatever they need to do. So take this piece off, and if you're worried about, like if it's a pediatric patient or a renal patient that you don't want to give them a whole lot of extra fluid, you want to use your syringe. Otherwise, you can just connect this to your IV. So I'm going to go ahead and flush that through, and I've got that ready. And is this a sterile procedure or is this a clean procedure?
Clean.
Okay, but you do want to keep your site as sterile as possible. So when I'm going to start here, once I wipe my site off, I'm not going to touch that again. So I see a lot of people, want to go back up here and touch because you've got clean gloves on. But think about it, you don't want that. I wouldn't want anybody touching me with whatever they've touched and then touching me and sticking me, because you can potentially infect them. Because you're providing an extension of the vein, and this is potentially going to be in for 3 days. Okay, so we've got our IV catheter, we've got our tape, and we're going to have an op site. Do you have that little? I'm going to go ahead and
This right here?
that one. Yeah.
Okay.
This kit is what we use a lot of times for starting the IVs, and it has kind of everything in there that you need.
That was scary.
Okay. So it's got what you're going to use to your rubber band that you're going to tourniquet. I like to go ahead and have this out and ready. And this inside this package here is a sterile field. So I like to go ahead and get everything, like I'll have my other tubing or whatever I'm going to connect to the patient in here, and that's going to be a sterile field so that none of my ports are just laying everywhere and contaminated. So I'm going to identify my patient, get all my supplies ready, know what kind of fluid I'm going to have for them, ask them if they have any allergies, because you can use lidocaine if you want to. It sometimes can distort the vein if you're going to use that. They have the little
Spray.
the spray or the cream that you can put on there as well. That takes a little longer for it to take effect. So I generally don't offer that. If they ask me to use it, I will use it. Because it can distort the vein and you potentially have to stick them more than once. Okay, so I've got all my supplies. I don't usually pull my tape off before, because what I'm going to do is just put this op site right over my site. But a lot of people do, and you want to make sure you have a clean area to do this, because you don't want this desk right here would not be where I really would want to put this, because who knows, how long it's been clean. I wouldn't want it on me, and I'm a NICU nurse, so I'm a little bit more of a freak when it comes to germs than other people might be. But I think that's a good thing, Okay. Because the most important thing is infection. They're going to, you can potentially give somebody a bad infection and potentially kill them if you don't do anything right. Okay, so I've identified my patient. I know what kind of fluid they're going to have. I've got my fluid already ready, primed, and ready to go. So I'm going to, where am I going to start for the vein? Where do I want to start?
Around the ribs.
I want to start, and why do I want to start low?
Just in case you mess up, you can move up.
Right, because these veins can potentially run into these veins, and if I stuck this first, and then I try to go back down here, it could potentially leak out of that, be in the same vein. Okay, so I'm putting my gloves on. Always use gloves. It's hard to get used to that, but you do not want to get used to sticking patients and then not being able to do that, because it's kind of dealing with the tape and everything. You can, if you want me to put them on, I can put them on.
And where they can see it.
It's just putting on regular gloves.
Just regular gloves, yeah. But you don't want to, you're potentially going to get blood and stuff on you, and you don't want that on you, and, you don't want to potentially infect them either if you've got, hopefully you're not infected, but.
Right.
So small is good. Yeah, I like to use the smallest that possible, so that they'll be nice and tight, so they won't be sticking to the tape any more than possible. Okay, So I've kind of already scoped my patient out as they come in, you know, kind of look around. You know, y'all probably are the same way. They're like, ooh, those are pretty veins. So I'm going to go ahead. I like to put the tourniquet on up here. You can put it on lower, you know, because it'll make all the veins kind of pop up.
Is there a reason you prefer just because all the veins pop up that way?
Well,
so high?
it's either way. It's just a personal preference. Okay, and you want to do it nice and tight. Okay.
So right at the cubital.
Yeah, I just go up here. Sometimes I'll put it up here where their gown is, so it's not digging into their arm.
Okay.
So it's no particular place. It's kind of just however you like. And I tell them to open and close their fist, and then do that a few times, you know, so those veins will be nice and juicy. And then I like a nice, I tell them to act like they're going to hit Mike Tyson, so that their veins will be nice and puffed up there. And so you have a nice, good vein right there. And that's one, and sometimes if they don't pop up right away, I will tell them, you know, I'm going to pat your hand there, you know, and I tell them that they probably have been bad sometime. So they don't usually mind it too much, you know, you don't have to beat them too hard. But you see how it's nice and standing up right there. Mm-hmm. So we're going to clean off the site. And then allow that to dry.